there's a breaking news everywhere. Let us understand some basics so that we not only stay informed but also act responsibly to stay safe. Please don't forget to share this with your friends and family for their awareness and safety too. Welcome to Nonstop Sense Channel. What is the coronavirus?
It's a highly contagious and dangerous virus that can fatally lead to death as well. It's called corona because of its crown-shaped appearance with spikes. As of now, the health experts advise the incubation period to be 14 days. It's a highly potent virus that's highly resistant to antibiotics. It belongs to the family of SARS and MERS viruses. SARS means Severe Acute Respiratory Syndrome. This was spread from bats in China in 2003, taking a toll of several humans. MERS means Middle East Respiratory Syndrome. This was spread from camels in Saudi Arabia in 2012, taking a toll of several other humans too. And now, coronavirus is linked to pneumonia outbreak in the city of Wuhan in December 2019 in Hubei province in China. The disease was suspected to have originated from a seafood market that was selling wildlife in Wuhan. Medical researchers from virology departments suggest that this must have been originated in the many-banded krait and the Chinese cobra.
Why is it a breaking news today?
Well, it's rapidly spreading from one human to another, either directly or indirectly. Wuhan has become an epidemic center now. It has already spread to other cities in China and other countries in the world. As of today, 300 plus people dead and close to 14,000 plus affected globally. About 100 plus cases have been reported in at least 25 other countries, including India. There is one death reported outside of mainland China. The unconfirmed investigative reports say that the number infected may be quite higher than what's reported so far, as many may be affected but yet to complete the incubation period. WHO, the World Health Organization, has declared this to be a global health emergency and has expressed concerns for those countries that do not have adequate resources to deal with. With the alarming rise in number of persons getting affected across the globe, and China being the second biggest economy in the world, it has a major impact on the global economy, with stocks tumbling all over and widely affecting the industries of tourism, airlines, hotels, entertainment and health sectors.
How does it spread?
They mostly spread from, number 1, the air, from viral particles from a cough or sneeze. Number 2, close personal contact, that is, touching or shaking hands, etc. Number 3, the infected particles, that is, high-touch zones like door handles, wash areas, handrails, billing counters, etc. in public places, and then one touching one's mouth, nose or eyes before washing one's hands.
Once affected, what are the symptoms?
Sore throat, headache, body aches, cold and cough, breathing troubles, repeated high fever, and diarrhea. It can lead to pneumonia and death too. What's scary is that we may not know any of these symptoms until the suspected incubation period of 14 days is complete by the virus in the affected body.
Is there a cure for coronavirus?
Sadly, there is no cure identified so far, and this is exactly why it gets deadly. However, health experts are working on a vaccination for this potent virus. They may take months together, as predicted, to test safety on animals first before release to humans. Once affected, we just need to treat this as yet another flu condition, as there is no other choice. Drinking fluids, taking flu medicines, etc.
Okay, what are the preventive measures?
Let's talk about China first. The 60 million Wuhan city is cut off, literally locked down from the outside world. All the public transport systems are closed. People are crying short of essentials. A 1,000-bed hospital built within days is released to treat coronavirus patients today. Another hospital on February 5th is planned too. In total, they are supposed to accommodate 2,600 beds. China has allocated $144 million to combat this virus. China imposes temporary nationwide ban on sale of wildlife. Beijing extended Lunar New Year holiday by a few more days. Restrictions have been placed for travelers to and from other cities. Strict screening measures are put in place in important public places like airports, railway stations, etc. There is an advisory issued to avoid non-essential travels to Wuhan. Now, the rest of the world. Leaders across the countries have called for global solidarity by joining hands and acting responsibly, which is the need of the hour. Some countries are restricting entries of people into their countries if they have visited Hubei or China in the last few days, calling this as level 4 emergency. And many countries have stopped flying out to China not only because of governmental decisions, but also because of the mounting pressure by cabin crew due to their unease about exposure to the virus. Several foreign governments have been flying home their nationals from China and holding them in quarantined areas on arrival for the requisite incubation period of the virus. Now, India in particular. Indian embassy was in constant touch with both their nationals and the government of China. Indian nationals were evacuated from Wuhan in 2 batches, of which 6 Indians reported to have unusual high temperature and hence retained in Wuhan itself. All the airports have stepped up their screening process, though the effectiveness is still a question, considering the potent nature of the virus and our population numbers. There is one case reported with this virus in Thrissur in Kerala, and the patient is quarantined now. All those who came in contact with her are also being quarantined and screened. Homeopathy Siddha medicines claim that they have medicines for this disease, but yet to be confirmed and officially announced. Now comes the important role player, that is every individual. We should try to stay away from crowded places, closer contact with people, and from people when they cough or sneeze. We should also stay away from sharing food and water from the same containers, particularly children to children exposure is quite high. We should avoid street food, spicy food, non-vegetarian, fried food and all other unhealthy food at this point of time. We should wash our hands thoroughly and follow strict practices of absolute hygiene. While being out, we should keep our hands off eyes, nose and mouth until we reach home and thoroughly wash our hands. We should keep hydrating ourselves with adequate water and healthy liquids. We can consume more of vitamin C foods to develop immunity within. We can use face masks and hand gloves whenever high-touch transmission opportunities are encountered. We should not neglect or self-medicate flu conditions at this time. It's better to isolate ourselves from others if we have flu symptoms. If we traveled to Wuhan or China in the last couple of weeks, it's better to get scrutinized right now. And the last but not the least, not to spread any unnecessary panic or misinformation over social media, but share only authentic and useful information as necessary.
We have reached the end of this video. If you want to add or comment anything related to this subject, please do so in the comment column. We'll feature useful and interesting responses in our future uploads. If you want to watch more of our works, please search for Nonstop